topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning, New York. Welcome to another Ask the Expert show where we bring you, for the last 16 years, we bring you the top experts in the field of legal, health, financial, and home improvement. Folks, our hottest show, I can't believe I said folks. I sound like I'm from Texas now. For the hottest shows we have going on now across the country are our Medicare shows. And I got to tell you, though I look like I'm in my early 20s, I'm on Medicare. I love Medicare. And I'm hoping that this show is going to educate you because I was uneducated and I made so many mistakes that were costly to me. And I don't want that to happen to you. We were able to find the top company when it comes to Medicare. The name of the company is Alcorn and Associates. We have with us today Dan Alcorn and Chris Amorosi. I hope I pronounced that right, Chris.
Perfect.
Good morning, guys. Listen, I was shocked at the numbers for our first show, and I am so happy because that means we're going to be educating people, and I want people to know and that it is so important that you get a good agent because my first agent was a nightmare. But good morning. Hey, Dan, tell us about Alcorn and Associates.
Thank you, Steve, for having us. And today is the first day of the
Yes.
2026 Medicare annual enrollment period. We like to call it opening day, first kickoff, whatever your analogy is. But we are a team of licensed independent agents, all based in New York, from the Canadian border to New York City and Long Island. As I said earlier, we were going to have more of us on the show this morning, but they're out on appointments because today is the first day. We're independent, we're licensed, we're not employed by any company. Folks can go to Medicare.gov and see what companies offer plans, but we choose to represent a handful of those that we think match our clients' medications, doctors, budgets, and travel needs. So we're excited to be on the show. Thank you. And looking forward to a very busy annual enrollment period. And my colleague with me this morning, as you pronounced it correctly, is Chris Amorosi. He is a veteran in the healthcare space, having been employed by some of those companies and now is working with us independent. Welcome, Chris.
Thank you. Yes,
Chris.
and to segue into what Dan was just saying, it's open enrollment. This morning I told my wife I'll see her December 8th when it's all over with. So
that's
just
good,
keep my dinner in the oven when I come home, and I'll see.
There you go.
Listen, I want to tell people, I was just talking about it before, it is so important that you get a good agent. Now, we're seeing all these commercials from these national companies, but folks, I got to tell you, it's different. And I'm sure it's like this in New York. It's different by county, it's different by state. You can't go by these national commercials.
Exactly.
And you don't want to just call into the company. My first agent, he was so bad. He was just like an order taker. And customer service is so important, isn't it, Dan?
Absolutely. When you work with an agent, we want to point out that that does not affect your premium, doesn't cost
Right.
the member anything. And it's just an extra set of eyes so that, if you enroll through an online service or directly with the company, that's all well and good. But your customer service number is 1-800, whoever picks up the phone. Whereas locally, your agent should be aware of the local hospital networks, provider networks, what's going on in your local community. Healthcare, Steve, is local. And so, we try to add that value to the relationship and to keep our clients informed throughout the year as to what may be happening in their local landscape.
Well, I got to tell you, I'm so glad we have you today, and I'm hoping. And I got to tell you, we started promoting the show several days ago, and the calls that came in with people with questions. The number one question, and
Hmm.
I'll address this to you, Chris. The number one question is, what is the difference between Medicare and Medicaid?
Yeah, and that's a great question because that's always, a topic. So Medicare, obviously, when you're 65 years old or disabled, that's when Medicare kicks in. But Medicaid is such a total different animal, and it's for the lower income individuals, and it gives them assistance with their healthcare needs. So where you just said you were on Medicare, not knowing your financial situation, but if you make, I believe this year it's $1,810. If you're below that level, now you're eligible for Medicaid. And when you're eligible for Medicaid, that just brings in a lot more benefits to help you get the health care that you need and to maintain that level of care that we all have.
Well, I got to tell you, there's so many people that I found out that were just like me, didn't understand when you can enroll, all the different procedures that involve Plan A, B, C, D. So, Dan, let's start off, people. Today is the first day. What does that mean?
That means if you're enrolled in a Medicare Part C, here we go with the A, B, C, D. Medicare Part C is called Medicare Advantage. And think about Part C as combining Parts A, hospitalization, B, medical, and D, drugs, into one plan. When you want to enroll in Medicare Part C or change your Part C plan, you can do that beginning October 15th through December 7th, when Chris will see his wife again. And that will take effect on January 1st of the next year. So this is when you can change the plan you're in. Now, some folks, Steve, are already enrolled in a Medicare Advantage plan. And last month when we spoke, we were talking about to watch their mailbox because changes were coming to those plans. It could be as simple as a premium change or maybe a copay change. And if members are comfortable with that, they don't need to do anything. That plan will just automatically renew into next year. But in many markets, particularly here in New York State, many of those Medicare Advantage plans are ending and people will need to find a new plan. So we're dealing now with literally, hundreds and thousands of people whose plan is being discontinued and they now have to go find a new Medicare Advantage plan or return to original Medicare and add a supplemental plan. So those are two distinctions. If I might just follow up though on what Chris mentioned about Medicare and Medicaid was great answer that one is federal and the other one is state based on the income. But they also have these plans called dual, where you take your Medicare and Medicaid plans and combine them into one, and that's called a dual Medicare Medicaid plan. And if folks visit our website, dgalcorn.com, under the 2026 Medicare plans, you drop down, you'll see more information about those dual plans. So it kind of marries the two of them. So
And
So
Steve, if I could just
go ahead. Yes, Chris.
piggyback on what Dan said, especially this year, and I've been telling all my clients and prospects, especially this year, because of all of these changes in our area, it is imperative that you try not to navigate this Medicare arena alone this year. It's
Mm,
just too confusing. And it's always good to have that broker, because once you become a client of ours, if you have a question, you can call us directly, and we just let our clients know that you're not alone in this process, because it can be overwhelming.
right.
Yes. Just got a text from Betty in Queens. Thank you so much for bringing a show like this. I can't believe there aren't more shows on this. I want to know, what is a supplemental plan?
I'll
Go
grab
ahead.
that.
Yeah,
Yeah, all
go
right.
ahead, Dan.
So supplemental is when you are not on a Medicare Advantage plan, you start out originally with your red, white, and blue Medicare card. But original Medicare doesn't cover 100% of your costs. There's a gap there, roughly 80-20. The government plan picks up 80%, and you're responsible for that 20%. You can supplement that coverage or fill that gap with what's called a Medicare supplement, sometimes called a Medigap plan, so that that part that Medicare doesn't pay can be partially, depending on your age, totally paid for. Those Medigap supplement plans can be pricey. Again, on our website, dgalcorn.com, there's a link right to the New York State Department of Financial Services. You put in your zip code there in Queens, it will tell you what plans F and G and N and all of that by which company and what the premium would be for you, Betty. Great question. Thank you.
Yeah, another question that just came in. See, you know what? It's amazing. We can just go by all the questions that who are watching or listening in. This one is, I'm listening on your radio station now. Uh, Sound, everything looks good. Thank you for bringing a show like this. My question is, what if you miss the enrollment date? What are the penalties?
Want to go for that, Chris?
Well, it depends on what you miss.
Right,
If you just turning 65, you have 3 months prior to being 65. You have the month that you turn 65, and then 3 months after you turn 65. If you fail to enroll in Part B, there is a penalty that is incurred for that. And then on top of that, if you don't enroll in a Part D plan, there's another penalty. And to go into those calculations, sometimes you have to have a 4-year degree from MIT to figure out its percentages and this and that. But these penalties, which is very important for people to know, these penalties will carry with you for your entire life. So it's just not a one-time penalty.
right,
It's a month after month after month, year after year after year. So the nice thing that Medicare has done is, so for these people who make the change from this October 15th to December 7th for an effective date of January 1, they also have an opportunity from January 1 to March 31st to say, hey, you know what, Chris or Dan, I tried that plan out. I really don't think it's for me. Can I make a change? So you have that opportunity between January 1st and March 31st to make that change. So I always tell people who are just turning 65 is to do things, start process 3 months before you plan on retiring or that you're turning 65, to give you a little bit of a buffer.
right. And if I might add, on our
Go
website
ahead.
again, sounds like I keep talking about go to the website, but at dgalcorn.com, you'll see a drop down for the calendar. And to Chris's point, there are certain deadlines that you may want to watch. The annual enrollment period deadline, by the way, the one from October today through December 7th, there is some extra time for those individuals whose plan is being terminated. So we want to make sure that everybody whose plan is going away, that there's some extra time after December 7th to make sure you get something in place for January 1. So I would say, do your homework now, get on it, get in touch with us, but there is some additional time.
It's so funny. We're getting questions in about ACH, the health plan, and people are complaining. Listen, Dan and Chris have nothing to do with that. Okay. That's the government. They have no say so. None of us do. I just wanted to say that here's a gentleman in Brooklyn. Thank you for the show. My wife and I watch many of your shows here in New York. This must be a new one. Thank you. My wife and I are getting ready to purchase Medicare. My question is, we live in New York 6 months out of the year and Florida 6 months out of the year. Where should we register?
Well, your Medicare account is where Social Security says you live.
Okay.
So if you live in wherever Social Security and the IRS and your bank account, those eventually all need to be synced up. So if your Social Security and your Medicare account is in New York, but your bank account address is in Florida, something will get flagged there. But to a larger point, if you're spending 6 months in one state and 6 months in another, you're going to want to make sure that your Medicare coverage, whether it's original Medicare and a supplement or this Part C Medicare Advantage plan, covers you where you may be. We have up in New York a lot of snowbirds are called that spend 3 months in Florida and enroll in a Medicare Advantage plan that has a limited network of doctors. And so there's some issues when they are spending 3 months in Florida or elsewhere and have a team of providers there as well. So we as a team work with our members on that. And I'll put a shout out to our agent Alicia, who does great work in Queens, Brooklyn, and Long Island. So she was on the show in September. But yeah, absolutely. If you're going to be in Florida, most of the time, then you want to make sure that your Social Security, your Medicare, and your bank address all have that Florida address. And then you would enroll in a plan that is offered to residents of that county in Florida. And we're licensed in Florida as well, I might add.
I got to tell you that I was talking about how important it is who your agent is, and I'm not sucking up, Dan and Chris. I promise you. But I got to tell you, I've been doing this for 16 years, and you see, I wish all my experts were like Dan. He is always on top of it. I'll probably hear from Dan 2 or 3 times a month. And what that shows me is that you're going to have a agent who is going to always be there for you. And I got to tell you, everybody is not like that. Some people I hear from once every 3 months. But I must compliment Dan the way you run your company. You're always right on top of it. And I just want to thank you for that. And it looks like a lot of the listeners and viewers want to thank you too.
Well, that's generous. Thank you. We try to stay in touch throughout the year with timely information. There's a lot of proposals and rhetoric in the marketplace right now, but once we find that something is final, whether it's a Medicare rule or Part D changes or your Part B premiums. There's been speculation, for example, as to what the Part B premium will be next year, the amount you pay Medicare. Well, that's not been announced by CMS, the Center for Medicare and Services. Once we know that, we then get that word out, and any interpretations of how that, whatever the issue is, we try to get the information out so that when our members get to the annual enrollment period, Their questions are fewer because we're trying to get them armed with information to make an informed decision for the next year.
And I gotta tell people, I just learned this the other day. Just because your policy says something, say from last year, you got to check every year. Because I just 2 years ago I got glasses. It didn't. I'm on Humana, on the Advantage Gold plan, and 2 years ago my glasses didn't cost me anything,
Mm.
not a dime. I went in for glasses yesterday, and I mean it's not that much, but it is. It was $160 now. So that's in 2 years. So it's really important that you check and see that your plan hasn't changed, because they change.
Well, if I
And
may, Steve, let me. The most important thing we're seeing in the 2026, and what we're encouraging all members to do, is double check that drug formulary. That's where the big changes are for 2026. Formularies are changing, deductibles are changing, the medications in the formulary, their tier levels are changing. That's where we're finding the greatest change. We encourage everybody to double check that before they stay with or change their plan.
and to go to Dan's point, that was one thing I drove home to my client base is between September 30th and October 2nd, you're going to be getting your annual notice of change. Please just don't throw it in the pile with the Women's Day magazine. You have to read it. If you have any questions, give us a call. We'll go through it line by line with you. Because to your point, Steve, it's very important to know what's changing for 2026 and not be blindsided.
Right.
Well,
Great
we've got a
question.
minute left. For the people who are listening on radio or on iHeart, Spotify, tell people how they can reach you.
So we have a website full of information that covers New York State, www.dgalcorn, that's ALCORN.com, or our office number is 518-346-2115. Our receptionist will be glad to put you in touch with an agent servicing your community, even get you on his or her calendar for a no obligation consultation.
And real quickly, someone just wrote in, do you also handle health insurance?
No, we just focus on the Medicare space.
Okay.
Great question. Thank you.
And listen, you guys will be back again with us next month. Thank
Exactly.
you so much. Dan, you're going to be getting a copy of the show in the next couple of days. We'll see you again next month. Thanks so
Thank
much
you,
for
Steve. Thank you,
such a
everybody,
Thank
for
great
you,
show.
listening
Steve.
in.
And
Appreciate it.
everything worked this time.
Yeah, all right. Yeah.
We're going to go to a break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.